Welcome back to the Beyond Electric Sheep podcast. I'm Brick Thompson.
And I'm Ed Daniels.
Hey, Ed. So let's keep talking about AI and healthcare. You were just asking me some questions. Thought it might be interesting to go ahead and record what our thoughts are on this.
Yeah.
So what were you saying?
Well, I was saying I wonder where AI is going in the field of medicine and healthcare over the next few years. Is it going to be so that we're just all talking into our iPhones and asking questions and getting diagnosed, or is it going to be something a little more complicated than that, and we still, go to the doctor's office, we still have go to a clinic or a lab, et cetera. What's the future going to bring? What do you think?
Well, so of course I have no idea, but I would guess that actually it'll just be a hybrid. I don't think it's going to replace doctors. I think doctors will probably use it to provide better care. I think people will, the general patient population will just get better access to getting their questions answered and probably show up for care when they need it more. I think of myself and my family. As a young family, it was very expensive to go to urgent care. It was hard to get an appointment with my primary care doctor for the kids or for me. I mean, you could do it, but often not as quickly as you might want to, especially if you had something that was sort of a question, wondering if this is something to worry about, but you don't really know. It's just too much effort, so you wait till your next annual physical, deal with it then. Now, my wife and I use I can't remember what they call it exactly, but sort of a private primary care where you pay
concierge medicine.
It's not really concierge, like not house calls and stuff, but sort of like that, so that I'm able to message the doctor on an application or an app on my phone and get an answer quickly, usually within an hour or two. And so, for example, I've used it when I got an injury, mountain biking, and I had a bursa sac blow up, Lacronon bursa, I believe, and was able to send him a picture. I didn't know what it was. And he said, "Oh yeah, that's exactly what it is. Here's the protocol for that. Here's what we'll do if it doesn't correct itself over the next several weeks," and so on. And in the past, it would have sort of been a decision of, okay, do I want to spend $1,500 to go to urgent care? Maybe I'll just let it ride for a bit. Now, in this case, not a big deal, but I'm sure there are a lot of people that it is a big deal for, especially if you're on a tight budget. If your health care plan, your insurance plan has a high deductible, you're just not going to get care when maybe you need it. And I think the AIs might help mitigate that, because you can have this type of interaction that I had with my doctor. Here's a photo. What do you think? And it can tell you, here's what I think. High likelihood. Ice it and let it rest for a few weeks. Or no, that looks like a problem. I think it's going to get infected. You need to come into urgent care. Okay, great. And then the doctors are there to provide the true expert, hands-on, maybe with some help from the AIs to provide really good care. That's just sort of one off the top of my head.
And you wonder how that will all work together. It'll be interesting. When does the AI respond to a question from a patient versus when does it get turfed to the human physician to deal with? So just the logistics of that will be interesting, and everybody's watching, of course. So
I know. Well, and I think it's interesting. You talk about an AI-directed surgery, surgical tool, robotic surgery, something like that. There's probably some cases where it's really been perfected. Like I think some of the eye surgeries now, the doctor's there to make sure it's set up right and it's performing right, but the robot's doing a good job. I drive a car that has, it's a Tesla, so it has this full self-driving.
Right.
It does a pretty good job of driving most of the time, except when it makes a mistake, and you better be watching so that you don't, drive off the road. Right. It's rare, but it happens. I think their stats are that it drives better than the average human in terms of number of accidents or fatal accidents per whatever million hours of driving. But our tolerance for a robot or an AI system blowing it and resulting in an injury or a fatality is basically zero.
Right.
We'd rather just have people who make a lot more mistakes. I don't know why. Right. That's just how we feel about it. And I think it's going to be the same way with physicians and surgeries and stuff too.
There's a whole nother area here, and that is the expansion of medicine and data collection into our lives elsewhere. For example, different kinds of monitoring systems, maybe heart monitors or sleep monitoring, tracking our sleep, and also for people that are, older or disabled, also monitoring for falls and different kinds of things like that. So there's a whole lot of data that's relevant to healthcare, but there's no way that your example, your primary care doc, is going to be able to monitor all those data feeds. So I think another area where AI is definitely going to be helpful is in filtering through all that huge amount of information and just sorting out the stuff that's meaningful, both for you, the patient, but also for the physician and other clinicians that are helping treat you.
That's interesting. I think you're right. And it makes me think of some of the things I've been reading about in healthcare having to do with liquid biopsy. Have you heard that term, where they take a blood test and look for DNA and RNA snippets in the bloodstream of potential cancers? And it seems like a great technology because it could catch something you don't know about early, but it has a downside of we're all developing cancers all the time that our immune systems deal with. And if you get one of these and it sort of starts flashing red on a bunch of stuff, it may not actually be important, but now you're worrying about all these things and running them down. And so you probably will have to fine-tune these AI systems. And maybe it's personalized. Like some people say, no, I want it to be perfect. But there's other people that would say, look, life's too short. I don't want to worry about every little thing. Just tell me about the stuff that's, going to put me in the ground in the next 10 years, that type of thing.
Right. But all these things need, today anyway, human oversight. And so, handling that whole workflow, I think, is just it's going to be a really important area of medicine and the whole medical workflow process.
Yeah. What do you think it's going to do to either number of doctors that we need or the care that we're receiving, or how we receive the care?
Well, I think if I were a radiologist just reviewing routine radiographs, X-rays, I might be a little bit concerned that not only might my job, if I'm in the U.S., get turfed to an Indian radiologist who's going to look at it, overnight and have the answer back, but also an AI could look at that image and probably come up with some pretty solid findings that's happened. So for one thing, there's the work displacement, which is going to be true in all areas of our economy. So if you're, in the medical profession, you got to be looking around the next corner to think about what the impact's going to be. Same thing with dermatology, because a lot of diagnoses can be done from the image. That doesn't mean you're going to be able to treat the problem or confirm it, but at least you can do some of that basic screening type thing. So that's one area that I think will be interesting.
So you think there's a bunch of fields in medicine that will not need as many people?
Yes.
As many doctors?
You can look at that two ways. One is, well, gosh, if I'm your regular run-of-the-mill doc, maybe this gets rid of my livelihood, but on the other hand, maybe it just gets rid of the stuff that's pretty routine to you anyway. Once you're trained, it's not really a problem to identify these types of things that the AI can identify. Maybe it's actually a work enrichment opportunity in that it focuses you on the things that really need your high level of expertise, and so it may actually be something that improves the job from a satisfaction perspective and intellectual stimulation perspective.
Yeah, interesting. Thinking about the radiology example, I wonder if radiologists might appreciate having the second opinion of the AI, because the last thing you want to do is make a mistake and not spot, something on the lung or breast tissue or something.
Right.
I don't know, maybe they would resent having that, but for me, I would love to have the double check.
Right.
This looks clear. Wait, let's run it through and see what the AI says, or maybe have the AI do the first look. But I think that's fraught, because the AI might say, here's the thing I saw, and so now you get all focused on that, whereas if you came in fresh eyes, you might have seen a couple other.
Yeah, how that works is a combination of psychology that you were mentioning, but also just the ability to analyze the image and pick out things that a human would see. Maybe there's some things in there that a human wouldn't identify that could be brought to that person's attention. So I think that whole workflow is going to be very interesting. But ultimately, it has the potential to really streamline the system, make the whole diagnosis and treatment process happen a lot faster. And so I think we can look forward to that.
Yeah, I think that's right. I think besides making it faster, I think that a computer system should be able to do correlations to a broader set of data than a human can. So if you're trying to figure out what's going on with a person, you can't quite, let's say they got some neuropathy or something, they can't figure it out. It's possible you could feed a ton of test results to an AI and get some potential diagnoses that you wouldn't get if you're the person, because you just can't keep all the data points in your head.
Right. And, that's happening on a large scale. I think AI is being applied to huge clinical databases, a lot of it de-identified, to be able to try to identify the correlates of, the development of certain disease states or the ability to diagnose them. So that's a huge area that is happening right now. And, most of that, of course, happens behind the scenes to most of us lay people.
Yeah, interesting. All right. It's going to be fascinating. Looking forward to great health care. Not that
Definitely.
I don't have it already. I mean, we've got the best that we've had in history, but it could get a lot better in the next short number of years.
And if we do it right, it becomes available to a lot more people that otherwise don't have access.
Yeah. Okay. All right. Well, I think we'll end there. Thanks, Ed.
Thank you.